Moments ago, I signed an executive order directing Arizonans to stay home.
It is a mandate. Stay at home. If you're a non-essential worker, stay at home.
Stay home, stay safe, save lives.
We direct a statewide order for people to stay at home.
A consistent message, stay home.
I'm announcing a stay-at-home order for all Virginians.
No Maryland resident should be leaving their home.
Metro rail ridership is down 90% of what it usually is. Metro bus is down about 60%. Coronavirus has significantly impacted public transit ridership. It truly is unprecedented.
When I first learned that public transportation would be, limited by the hours, it was actually very stressful. When I first found out was when I was actually going to work, and I didn't know that the bus would be cut into times. One day, my bus never came, so I was going to be at work late. I had to call an Uber to get to work. It was very stressful.
We're talking just really, really big impact as people stay home, as people work from home, as people, limit travel. It's really nothing quite like it that we've ever seen. My name is Jordan Pascale, and I cover transportation for WAMU Public Radio. It's Washington's local NPR station, and I've been covering transportation here for about 2 years, but I've been covering transportation throughout my career in Nebraska, where I'm from, and also in Virginia as well. So many people thinking about the future. Obviously, we've known some sort of pandemic was going to come at some point, and it likely will come again at some point. So, Metro was lucky enough that they had already planned for this. They had a playbook in January, February. They were already buying cleaning supplies and stocking up on gloves and masks and all that sort of stuff for employees. In Montgomery County specifically has been responding very well to the pandemic. Early on, they were pioneers of getting masks, individual masks from the county that they purchased, and they put them in baggies and made them available on buses. So that's, mask wearing is one of the key things to stop the spread of coronavirus.
My name is Malick Ikourou, and I currently work at the Home Depot in Shady Grove, Gaithersburg. And at Home Depot, I am a guardian associate over there. I'm also at Montgomery College, where I am enrolled in television and broadcast media, where in the future I plan to go into TV or into the film industry.
Football fans are witnessing the downfall of the pro league.
I live
XFL.
in Gaithersburg, Maryland. I currently live with my mom and dad. I have a little brother and a little sister, and an older cousin and an auntie. My shift at Home Depot, it is from 6 p.m. to 10 p.m. Since the pandemic happened, I have been working since the beginning of March till now. But my routine to going to work usually is, one, my mask. Always I have my mask. I have a box full of masks. Some days I wear gloves, and when I'm on the bus, I will sit in the far corner, because in the far corner of the bus, it's less likely that someone will come sit next to you than if you sat in a two-seat. So for me to get to work, I would walk down the street and catch the 64 to Shady Grove. But once I get to Shady Grove station, I would go to the other side of the station where I would catch the 43 to Transville. The 43 to Transville would come at the end of the hour. And literally, by the time I get to Home Depot, by 5:55. So I would have to speed walk down the street into the store, clock in by 6 p.m. to make sure I'm in on time. Then I go on with my day, and I repeat that the next day, and the next day, and the next day.
This is a 7000 series train. This is a red line
Whether it's safe or not to ride on public transit is one of the toughest questions I think a lot of people are thinking about as individuals right now. I know a lot of workers are still able to work from home. There's a lot of people that don't have that luxury. You've got your essential workers that are the grocery workers, the hardware store workers, people that have to go physically to their jobs. Those people are already making those decisions every day, and it's the decision between, do I feel safe on public transit or do I earn a paycheck? As to whether it's safe, we don't know yet. We've got bits and pieces of data. The CDC came out recently and said that transmission through surfaces isn't as prevalent as they once thought. So I mean, it lives on a surface for a little bit, but they say the chances of passing it, from touching it to touching your face, is rare, and that you probably don't get it that way. It's mainly transmission through these air droplets. I hadn't taken Metro since March 13th or March 15th or something like that, and recently was on a bike ride and my tire went flat, and so I had to take the train, and it was very full. It was probably 7 or 7:30 on a weeknight, and it was the sort of thing where you got on and there were pretty much people, not every seat, but there certainly wasn't 6 feet of distance.
One thing that some people don't know is the bus has a limited amount of space. The bus driver only allows 12 people at max on the bus. You're that unfortunate person who is 13th, the bus is gonna say full, and it's just gonna drive away, not even stop for you. That's another big con about taking the bus, the limited amount of space. Public transportation, to be completely honest, I personally don't think it's safe. There are some people who go on the bus and you're required to wear a mask when you get on the bus, of course. But literally the other day when I was coming home from work, this lady didn't wear a mask.
The mask policy is something that is technically mandatory, but is not enforced. They don't want to get into altercations with people over whether or not to wear a mask. They're really relying on a lot of social pressure, a lot of kind of peer pressure to enforce that policy.
What I'm most fearful is I'm more scared for my family than my own self, because you can have the virus and not show any symptoms of it at all. I have a little brother who has asthma, and my mom, she has some medical problems in her history, so I'm more fearful for the people around me. Despite all the bad that's going on, what I'm very grateful for is I have a job, I have friends who lost their jobs, who aren't making any income right now, and it's hard for them to get on unemployment, and it's a very long process for them. But me, however, I'm still able to bring home a paycheck. I'm still able to pay my personal bills, help my family out. I'm very, very grateful for the fact that I am making income. It's a blessing.
I think a lot of people, especially people in public transit agencies, are looking forward to a normal. I don't think there is a going back to what we had. There's a lot of industries that will never go back to what we had before. Even after the pandemic's over, I mean, we'll be conditioned for many, many months to keep 6 feet away from people. So what does that look like? It's going to be a really big challenge for public transit, because the whole idea of public transit is moving a lot of people quickly at the same time in small spaces. So, when will that ridership come back? How will the funding respond? Will transit have enough to keep going? There's so many questions that are going to need to be answered, and I guess it'll take probably 6 months, a year plus to know all the answers.